It was a cabinet decision that the Prime Minister announced and the Ministry of Health communicated to healthcare workers, but which, apparently, the cabinet had not made. COVID-19 booster shots are mandatory for healthcare workers in St. Vincent and the Grenadines every 5 months if they are to remain on the job. Only that the cabinet never made the decision. Well, that is the explanation at a press conference attended by all the members of the cabinet who were in the country on August 9, 2022. Prime Minister Ralph Gonsalves had announced on July 28 that the cabinet had decided 1 day earlier that COVID-19 shots as well as boosters would remain mandatory for all healthcare workers in St. Vincent and the Grenadines.
One matter which I want to mention, decision took place yesterday in cabinet outside of the Veep, but I wouldn't get an opportunity to speak to the press in this way. I received recommendations from the Chief Medical Officer in relation to frontline workers, that is to say persons in health, the teachers, certain categories of public servants, including those at immigration and customs, and of course those at the airport. And these are the recommendations made by her, and these are the recommendations. We had a discussion yesterday with the Chief Medical Officer, who's formally on vacation, but she came, and also the Deputy of the Health Services Subcommittee of NEMO, Dr. Roger Duncan, and we agreed on the following new regime. The Attorney General was there, so the relevant changes would be made. For the healthcare workers, they will remain, and any new person entering would have to be fully vaccinated and boosted.
I want to mention something, and I'm sure the Minister will mention it when he has an opportunity to speak. I understand that yesterday on social media and in some news outlets, there were reports purporting to state that the Ministry of Health was mandating COVID booster shots for healthcare workers, or words to that effect. I want to indicate to the public unequivocally that this is not the case. There appears to be, or there appears to have been, a mistranscribed note from the cabinet when we were discussing the easing of restrictions related to teachers and civil servants. We also decided at the time that we would strongly encourage the taking of booster shots for all citizens, but in particular frontline workers and healthcare workers. And it appears that there was a mistranscription that was sent to of that decision that was sent to the permanent secretary, who then faithfully relayed that that erroneous record of the cabinet minutes to the healthcare workers, and then it was subsequently reported. But that is not the case. The minutes of that cabinet meeting will only be reviewed tomorrow in cabinet, so we didn't catch it. It went out. But all of us were busy texting one another last night saying, which mandate is this? Who said that? I don't recall that. And the fact of the matter is that it did not occur. We do strongly urge all Vincentians, and particularly healthcare workers and frontline workers, to take the booster. But it is that urging is not in the form of a mandate. It is simply something that we would hope that people do for their own safety and for the safety of the people that they serve. And I'm sure the Minister will speak to that more fully lately.
Thank you very much, Carmelo. First of all, let me say good morning to the press and all the listeners to us here in St. Vincent and the Grenadines and those abroad. First of all, up front, would like to echo and re-emphasize the statement made by the Minister of Finance regarding the mandate for booster vaccines for healthcare workers here in St. Vincent and the Grenadines. There is no such mandate. The Minister has already said that. We are not going down that road. As a matter of fact, we are at this moment trying to ease the responses to COVID-19 as we try to get back to normalcy. We're not trying to put any more constraints on people. So I think by now, or maybe later on, the memo which went out to the healthcare workers will be rescinded. As the Minister said, there was some problems in terms of misinterpretation, and some things were mistranscribed, and it got into the media. I just like to say that it is not so. We will not go down that road immediately. We have not thought about it. We have been talking about encouraging people to take boosters, especially if you're vulnerable, if you have underlying conditions, etc., older people and that kind of thing. It is optional. We hope that persons will still take these vaccines because we are not yet out of the woods. The emergency, the public health emergency has not been lifted. We're still under that particular condition. However, we did not say that we have not decided that we should have mandatory vaccines, boosters for healthcare workers. I hope we have made ourselves clear in that regard.
As you know, the Prime Minister is still out of state. He's in Taiwan. And, of course, as leader of government business at this time, I'm happy that we are able to share this information with the public as early as possible, and even in the absence of the Prime Minister. Of course, it is regrettable that the information as it relates to the COVID-19 vaccine that is to be instituted by the Ministry of Health, that the information which has gone out is not really of the decision of the cabinet, as I recall it, because before the Prime Minister went out of the island, we had a cabinet meeting specifically to deal with this issue. And I'm sure the Prime Minister himself will be somewhat shocked to hear that the decision that has gone out is not what was fully captured in the cabinet. And so, of course, Minister Gonsalves and Minister Prince, Minister of Health, has alluded to the fact that there was indeed some misconception as to what took place at the cabinet. And of course, we will review at the cabinet meeting tomorrow the decision. I'm happy that we have been able to bring it to the fore and to get it out to the public as soon as possible. As a matter of fact, it is this morning that I was in touch with the Ministry of Health on this matter. I spoke to the PS on this matter, and that I've asked him to withhold on that decision going forward. You know, when I learned of this information yesterday, I was really taken aback, because yesterday morning, at around 10 o'clock, I had approximately 1.5 hours discussion with the Ministry of Health, and this information was not even surfaced.
First of all, we had them, and I'll let the Minister of Health fill in. The Chief Medical Officer, Dr. Duncan, the Permanent Secretary, the members of Health came in with various proposals about how we should deal with this new phase of COVID, where there's still very transmittable mutations and variants of the disease, but they tend to be, in our experience, with a lower mortality rate. And that the fact that we were coming out of a carnival period where cases may have increased, certainly hospitalizations and deaths had not increased. And this was a new dynamic that we were experiencing now. And we were trying to discuss what was the best way to adjust the protocols to deal with the new dynamic. There was discussion about teachers, and I think that the decision for teachers and civil servants has been very clear. The decision was in the healthcare sector that we would not have unvaccinated healthcare workers, on frontline workers, that the vaccine, the necessity of a vaccine would continue to be a condition. But that wasn't a huge issue because the overwhelming majority, close to 100% of the healthcare workers, were already vaccinated. The question then turned to what we would do with boosters, because as we all know, the science is now saying that the vaccine wanes in efficaciousness as time goes on, and then boosters are necessary to maintain a particular level of resistance, and then even the efficacy of the booster wanes over time. And the discussion was then, what would we do vis-a-vis boosters? And the decision that was taken at the cabinet level was that we would strongly encourage the taking of booster shots. That was the decision that was taken, strong encouragement for boosters. There was no decision taken by the cabinet to mandate boosters for anybody. And you would think, because we've been discussing this now for over a week, the Prime Minister has been on the radio every day, the Minister of Health has been speaking to it, other healthcare officials. This is not something you could hide. We wouldn't be talking about the testing requirement, we wouldn't be talking about teachers, we wouldn't be talking about civil servants, and then try to slip in as if nobody would notice that we were going to mandate boosters every 5 months or something like that. This was simply not a decision of the cabinet. And of course, that does not mean that we wouldn't like all frontline workers, indeed all vaccinated workers, people, to take the booster. But it is not a mandate, it is not a condition of employment. The sad truth is that where we stand right now, there's still not enough people in St. Vincent and the Grenadines vaccinated. And below that, there are far too few people who have been boosted. There are a number in excess of 30, approaching 40,000 people who have been vaccinated, but the number of people who have been boosted is under 4,000. So you're talking about 10% of the people who have been vaccinated, a little more than 10%, but round numbers, who have been vaccinated have been boosted. And then some of those people who have been boosted are probably due for another booster already because they got boosted early in the process. So there's a situation, and I'm not a doctor, where the efficacy of the vaccine is waning. There's a situation where a lot of people caught COVID, tested themselves at home, stayed at home, so they have some residual resistance at the moment. But we still don't know what new variants will bring, and we don't know what will happen when people's herd immunity begins to wane somewhat. And so we continue to encourage the vaccination and boosting. I don't know, Minister, if you want to add anything.
Well, Minister, you articulated well what the mind of the cabinet was. I'd just like to remind all of that, as I said before, we're still under a public health emergency, and we still have to take precautions. People are still dying from COVID. People are still getting sick from COVID. And one death is a lot, especially to the families involved. It is our responsibility in the Ministry of Health and the Health Services Committee and Cabinet to encourage persons to protect themselves. While we're not mandating it, we're saying that we strongly encourage you to either get boosted, get vaccinated if you're not vaccinated, use all the other tools, all the other protocols that we have enshrined over the past couple of years. I have not been advised other than that, otherwise, with respect to people protecting themselves against this very dangerous disease still. I apologize for the anxiety caused by our recent memo among healthcare workers, but as I said before, that was not the intention of Cabinet. It is still not the intention of Cabinet. All right, and I hope that people will take this on board, that we are still under a public health emergency and that we need to protect ourselves.
I just want to get a clarification from the acting Prime Minister. Please let me know if I misheard you. When you did you say that you told the PS to hold off on this decision or something to that effect. Can I get a clarification on what you actually said, please?
Of course, you have told all of the different pronouncements from the ministers, Minister of Health, Minister of Finance and Economic Planning, that the Cabinet has, in its discussions, have never ever said that there are mandates for such vaccinations and such boosters. And therefore, the Cabinet, in its wisdom, has indicated strongly that we recommend vaccines and we recommend boosters. And that's where we are.
I have a question for the Minister of Health. Minister Prince. Health. We had a case before where sanitation workers were included under the mandate and they should not have been. And your predecessor in the Ministry of Health had issued a memo that became public that communications from the Ministry of Health should not be sent out without having first been seen by the minister. Do you think that in light of these developments that that is probably a useful practice?
Well, I can't talk to the issue of my predecessor. What I could say is that we send out communication from the Ministry of Health from time to time. I don't have to see all of them. I don't think. Some of them the PS would consult. Other information coming out would go directly to the press. I don't have a stringent problem with it, as to everything must go through me. No. That is not what I would want.
We have. I just want to say that I really hope this press conference doesn't become a press conference about an erroneous memo when we're talking about building a hospital in the country. But I just want to say this. Cabinet discussed this issue, and because of not for healthcare workers, but because the school term was beginning, the Prime Minister wanted all communications to get out quickly. There are some things that you wait, Cabinet decides, you wait a whole week for Cabinet to review the memo, check the minutes, approve the minutes, and go forward. And then there are some things, because of the urgency, where the Prime Minister says, let's move with these things, let's get them going. This is one of the things that the Prime Minister wanted communications out quickly. Because for those teachers, this is not healthcare workers, for those teachers who intend to apply for employment, the time is short because they have to be employed, they have to be interviewed, they have to be employed, they have to be assigned and everything. So the Prime Minister's direction was that the decisions of the Cabinet regarding the modifications to the COVID protocols be transmitted quickly. Sometimes in haste, something is mistranscribed or miscommunicated, but this just did not happen, and we would not have tried to sneak it past the public, because it's not possible to sneak past the public, because all the healthcare workers would then say, how come I never heard anything about this every 5 months vaccine requirement? We'd have spoken about it. And we didn't speak about it because we didn't know about it, and we didn't know about it because we didn't make the instruction. It's that simple, and we regret any confusion and upset that was caused. We continue to strongly recommend it. Hopefully somebody wants to know about the hospital now.
The government's announcement of the retraction of the memo came hours after the Public Service Union said on radio that it would rally its members against the mandate. The union commented on the development at a press conference also on August 9, which it had scheduled before the memo became public.
I listened to the press conference and I heard what the Minister of Finance said. Of course, I see it in one particular way, that they have withdrawn it. I don't think it was an error. I think they probably got wind of the pushback by workers, because it's something that incensed a lot of workers. Up to this morning, everybody just keep talking about it and say, they are not going to be doing this. They're not to do it bad. So we didn't really, after it was withdrawn, we didn't really think it was necessary to speak about it.
But was it withdrawn, or did the government say that they would withdraw it? Are they one and the same thing?
The government said it was a mistake.
But you said after it was withdrawn.
Because I am saying that it was withdrawn.
I went to the press conference, and what was said at the press conference is that it will be withdrawn. But has it in fact been withdrawn?
Well, if the minister say it was an error, and it was not the decision made by cabinet, and I think I heard the deputy PM even made that statement too. It's not the decision. It was not the decision made by cabinet. The Minister of Finance also made that statement. So in their mind, there really is nothing to really withdraw. That is how I see it. But I'm saying it was withdrawn because I think it was intended to be sent out.
Okay, in the same, on July the 28th, I heard you quoting something. I'm not too sure what you were quoting, but I listened to the press conference in which the Prime Minister said that the decision taken by the cabinet the previous day, which was the 27th of July, was that vaccination and boosters would remain a requirement of healthcare workers. But he did not say at what frequency these boosters would be taken. So in light of all of this, I mean, what is the view of the union? It's simply a case, are you saying that, oh, well, it was sent out and the government said that it was withdrawn. But there is a context in which all of this took place. And I mean, I want to make sure that I stay within my realm as a journalist, but I sit here and I get a sense that the union is giving the impression that the government should not be trusted, and please correct me if I'm wrong in that conclusion. But at the same time, you're simply saying, well, oh, it was withdrawn, and in fact, you didn't even speak about it at all this morning, after speaking about it extensively last night, as if it never happened.
Kenton, I understand where you're coming from, and perhaps our decision, you see, since it was, well, you can't say it was taken off the table. Since they have admitted that it was never intended to be, like it doesn't exist, right? But our view, which is quite different, what's the message that we communicated regarding this particular issue? And as I've said, I do believe it was intended to be sent out. The union had already begun to mobilize. And I have said to workers to this morning, do not be fooled by what is being stated. And you have to be vigilant. Because I also listened to the Prime Minister spoke about vaccinated and boosted. So I strongly believe that was the intent.
So what was the position of the union then, on July 28th, when the Prime Minister first announced this requirement for booster shot? Did the union have a position then, or is it that everything that was said on radio last night was in reaction to this memo, which the government is now saying that should not have been, was a miscommunication? Notwithstanding the fact that more than a week earlier, the Prime Minister had said publicly that booster shots are required for public health workers.
We were waiting on the government to make its position clear on that, because I heard about the booster shots, and a lot of the stuff that was said then came out in a cabinet memo from Service Commission. So whatever decision they made was sent out in a press release from Service Commission, but there was none regarding the booster shots, right? So we were waiting to see Whether this was just him speaking.
The head of the cabinet, the prime minister, whether he was just speaking about saying that the cabinet had made a decision.
The cabinet decision came out in the cabinet memo. From so that was not present.
Are you suggesting that if the prime minister comes and say that the cabinet said something, that it's not a decision of the cabinet?
No, I'm not suggesting that. I'm saying that was not present. The bottom line is this: if the government decides at some point to come with any requirement for boosters, it will be resisted by every healthcare worker, and resisted strongly. And this time, actually, it's going to be different. This time, it will be different. Like I said, we had already begun to mobilize the workers, because every worker, last night we would have touched on all of the names, the job position of all of those workers, from the kitchen cook to the meal attendant. Every worker, I assure you, was going to stand their ground on this. This morning, when I went to work, that's the first thing they were talking about. Somebody will say, listen, I'm a labor man, but you see this? This is not going to stand. Just tell me when already. So this was across political lines. People were just going to respond, and respond in a unified manner to stop it. I'm confident of that. So whatever they intended to say, to me right now, the fact that that's why I say, in my view, based on what I have listened to and heard, it has been withdrawn. They say it never happened, fine. It has been withdrawn. And I do not expect that this will ever be put to workers again. Because anytime the government decides to do that, they will be faced with the brunt of the working force.
Are there